is Suzanne Robertson, and I work as a spiritual care practitioner in an intensive care unit at a hospital in downtown Toronto. Pre-COVID times, that meant I emotionally and spiritually supported patients, families, and staff throughout experiences of trauma and loss, death and dying. But since March, how I go about doing that work and who I am working with has been rather unparalleled and extraordinary. My unit is filled with hardworking, low-income Torontonians, people who are underhoused or can't possibly adhere to self-isolating protocols when you are a family of 5 in a 2-bedroom apartment. They are hourly wage earners who have no safety net, no benefits, no sick days. They are PSWs, cleaners, taxi drivers, grocery workers, migrant laborers from poultry and beef factories. And hands down, the majority of patients on my unit during this pandemic have been people of color. No longer are families allowed into the hospital, as we are on lockdown like all hospitals in Ontario. And our ICU in April and May was filled primarily with COVID patients who required maximum life-sustaining therapies. Over the past few months, the age range of COVID patients I've been caring for is anywhere from early 20s to late 50s. The youngest patient we lost was a 20-year-old woman, the oldest an 82-year-old man. Over the past 2 months, I have stared at the stunned and devastated faces of children, adolescents, husbands and wives, patients and siblings that have lost a family member to COVID. Sometimes, if the ICU team can roughly and imperfectly predict the impending timeline of a person's death, we're able to grant exceptional circumstances to enable 2 family members at the bedside to say goodbye, but just as often we can't, which inevitably involves myself or a colleague taking an iPad and running it up and down the body of their now deceased loved one so that family members can try to comprehend the magnitude of death without being able to physically be there. A few weeks back, I had been caring for a patient in his mid-30s who had come to us in critical condition as COVID had attacked his lungs and begun shutting down all of his organs. He had a 6-year-old daughter. He lived in a very small house filled with multiple generations of his family. His mother worked in a long-term care facility. She was the one who first became ill, and then because of how highly contagious this disease is, it spread through the family like wildfire. On the last day of this patient's life, we had to tell his mother she couldn't come be with her son as he died because she remained symptomatic, and all we could offer was to hold the phone up to his ear so she could say her goodbyes. These situations, horrible as they may be, are repeated over and over again. So what can you do? A good question. An important question. Besides the obvious, adhering to the guidelines of Toronto Public Health and the province regarding physical distancing and safety measures, if you come from a place of socioeconomic privilege, understand that you're doing this as much for the stranger as you are for your own vulnerable family members. Get interested in the social determinants of health. Read up about the conversation on guaranteed basic income. Ask yourself how a family survives on $14 an hour. Why is that okay in our society? Talk to your MPs, your MPPs, your city councillors. Volunteer at organizations that work towards more equitable and just communities. Lives depend on it. And if you truly believe, as I do, spiritually, ecologically, socially, we are interconnected. As Dr. Martin Luther King Jr. reminded us, we are caught in an inescapable network of mutuality tied in a single garment of destiny. Whatever affects one directly affects all indirectly. Be more than words, be more than yearly donors. Be more than abiding in the sanctity of security. Be action. Be agents of change. Be disruptors. Be shit disturbers. Be compassionate. Bestow the love for your own life upon the life of a stranger. Thank you. Thank you for taking the time to listen.